Dr. RMD, what do you think? Today's session, like it's on vitamin, minerals, and porphyria. How do
Yeah,
you think the
we have
everyone
started this
is?
quiz with the most important topic. I think there was
Yes.
good response also. Like many of them had commented after the instructions part of the quiz, the video
Mhm.
which I had uploaded yesterday. So after
Mm.
that, we have got many queries regarding like many thankful comments. Like people were thankful that we have started this initiative because it gives them a sense of accountability. It gives them a sense of like validation, like they have completed this topic and they are good enough to go ahead for the next topic, or else many students will be stuck in the same topic for a very long time.
That's true. That's true. And over
And now they
here,
will be actually seeing competition, the level of competition, the like how others are prepared. Okay, so this is a good platform for them to know how much they should really prepare.
guys, this is gonna be cutthroat. Like, I hope you're like, have your socks pulled up because it's gonna be cutthroat.
For JuxtaMed quiz, we have myself and we have two more organizers. One is Dr. Rupal and Dr. Manoj. So we three are conducting this quiz together. So today's questions are framed by Dr. Rupal and Dr. Manoj. So we'll be starting quiz in next 3 minutes. So whoever is has not joined the quiz, kindly join using the quiz link that is provided.
Yes.
Kindly join the quiz link. We'll start exactly at 10. Okay. Let's see how many have joined.
Oh,
Okay.
it's a good
We
response,
have
Madison.
around
We have
60.
many.
We have around 60 players who have joined. That's really good. So you guys will be competing
Goodness.
among yourselves. So you'll get to know the level of competition that is there.
Oh Lord. Oof. We've got like numerous new people joining, and we got
Yeah,
our legit winners also. I can see Narsimha, then Hemant is also there. Oh, I see Dr. Akash also. Ah, nice.
We'll
Nice.
start the quiz in next 2 minutes. Okay.
The time is ticking.
Because we have many more students who are joining right now. That means this initiative has been welcomed by many students because it helps them to complete the portions. I think that is more important for them rather than just studying blindly. What do you think, Dr. Manoj?
yes, sir, definitely. As you told, it's a good way to be accountable on an everyday basis, and they can assess the competition also. It's a good way
Hmm.
to a friendly competition.
Friendly competition. The one that which, gives them validation and rewards. This is just
Yeah.
something new.
Yes, I think we are good enough to go. Anyone who wants to join can join consequently. We have total 74 students who are participating in this, which is really a great thing. Okay. So let's start it. What do we say?
Yes, I think,
Sure.
yeah, we can do that.
Yeah.
Let's go.
Yeah, let's go.
All right. So, good evening, everyone. Welcome to this JuxtaMed quiz where we diagnose, discuss, and sprinkle in some humor to keep things fun. I am Dr. Rupal, your host and quiz master for tonight.
And I'm Dr. RMD. You all know me.
And I'm Dr. Manoj, here to remind you that medicine isn't just a science, it's also an art. An art we are all still figuring out.
We have got some fascinating cases for you today. So let's put those diagnostic brains to work. Rules are simple. We present the case. You've got 30 seconds to crack it, and we'll share the answer as well. So, ready to dive in? Let's go. The first question. A 5-year-old child presents with delayed wound healing, growth retardation, and frequent diarrhea. On examination, the child was erythematous skin lesions around the mouth, perineum, and acral areas. Which of the following enzymes is most likely to be deficient in activity in this condition?
Tick tock, tick tock. Remember, this case is all about missing micronutrients. And time is up.
Yeah, we'll come back to the answer in a moment, but here's your hint. It's all about the small deficiency causing the big problems.
Oh, guys. Okay. All right, guys, this is your first go, so don't get disheartened. And let me just remind you, each question gives you a chance to be in the top of the leaderboard. And the faster you know the answer, click on it. Because of that, you will get extra points as well. Okay, so let's
Here
go
is
to the
your
next one.
next.
Yes.
Here is your next question. A patient has complaints of recurrent abdominal pain, reddish discoloration of urine that darkens on standing, which is an important clue. History of alcohol consumption and a family history of similar complaints. No signs of pallor, jaundice, or organomegaly. Elevated urinary porphobilinogenesis. What is the most appropriate treatment? Okay, your 30 seconds are here.
Think carefully, guys. It's about stopping the metabolic mess, which happens before it spirals out of control.
I hope you're letting those thoughts brew. And they did. Okay.
This is an important PYQ, which is very confusing.
I
Right.
guess we are twisting their minds enough.
Yeah.
Let's see what's the leaderboard say.
Ankit is leading now, followed by Anusha, Krishna, Sophia, Tanya, Sai Taruni, Pooja, Madhu, Akhila, Mahima, and then we have many more below. So,
Good
yeah.
going, guys. Good going. Let's keep up the pace. Even though you guys do not know the answer, that's not a problem. Just click on the answer. It's just not at all a problem, guys. You are not, there's no, 1/4 minus marking, no negative marking. So play your
Yeah, I
field.
think we should have put it as a disclaimer, no negative
Disclaimer.
marking.
Okay. So moving on, your third question, a 40-year-old
Okay.
vegetarian
Yeah.
female presents with diarrhea, depression,
Fatigue.
fatigue and irritability and mild pallor. She also reports difficulty maintaining balance while walking and tingling sensation in her feet. This is too easy. Serum homocysteine is elevated and serum methylmalonic acid is normal. What is the reason for her symptom? Tingling
This
sensation
is
was
one.
the easy one.
Yeah, this was the easy one. But still, you see, they're confused between folate and vitamin B12, and exactly they'll be committing the same mistake in the
Same.
exams also.
This is true. This is true. So, all right, guys. Who's leading now? Woof.
Okay, Krishna, Anusha, Sophia, Sanjana, and Madhu.
All right. Keep going, guys. You're doing well.
Yeah, a 6-year-old child from a rural area presents with complaints of night blindness, dry skin, and scaly skin. On examination, Bitot spots are observed on the conjunctiva. Which complication is least likely to occur if this deficiency isn't corrected?
Hmm.
You've got
Okay.
30 seconds.
The time keeps ticking, and the faster you reply, the faster you click on the right answer, you'll have the points.
The
Let's
3 day, the 3Ds aren't just for a bad day. Sorry. Sorry. This is vitamin deficiency question. Okay.
right.
And we have got majority with correct answer.
Yay! Wonderful. Great.
We have Krishna who is leading with the longest streak.
Woohoo! Then followed by Sanjana and Sai Taruni, Madhu, Prakhi. All right. So let's move on to the next question.
A 45-year-old female with celiac disease develops keratomalacia involving less than one-third of cornea. What is the stage according to WHO grading? So there are two facets to this. One is a patient developing keratomalacia in the setting of celiac disease, which itself forms the base for a question. And the second is what is the grading of corneomalacia or corneal ulcers?
I would like to
Yeah,
remind.
and this grading system isn't just for the exams, it's also to recognize the severity in your daily OPDs.
You just spoke my mind, Dr. Manoj. I was just about to say that. Ooh, okay. So we got people who are answering the right. You guys are similar, but you can go through. So moving on. Look at this. The tables have turned. It's Madhu who's leading now and also having the longest streak.
We also have our old player, Sriraj, in
Yeah,
the fourth place.
nice.
Okay, a 10-year-old boy presents with delayed wound healing, alopecia, dermatitis, and recurrent infections. Which mineral deficiency is most likely seen here?
This
Okay,
again
let's see.
is confusing for few people with two options to rule out. So that is the point of this quiz because in INICET and NEET, you will get exact similar questions and you'll be stuck with two options. If you say NEET 2024 paper, you are stuck with two options.
Right, that's right.
Yes, sir.
All right, folks, moving on.
Madhu is leading right now, followed by AG, Sriraj, Sanjana, Swasti, Faizi, Tanya, Sai Taruni, Dr. Advik, and Rockstar. Okay, so let's move on with the next question.
Guys, this is the second last question.
Which
Okay. Which vitamin acts as a cofactor for gamma carboxylation of glutamate residues in clotting factor? I hope the clotting factor is a big hint for you.
think of a vitamin that keeps bleeding at bay, both literally and figuratively.
Yay!
I suppose this is the easiest question of all.
Yeah.
Yay.
So it's Madhu who is leading again. I think Madhu has got the hang of the game.
Yeah.
Followed by AG, Sriraj, Swasti, and Tanya.
Woof. So, guys, second last, the grand finale.
Okay, here's a quick one. All porphyrias are autosomal dominant except.
This question appears so simple, but the names of this porphyria and their clinical features and the molecules involved and the enzyme become so confusing, and participants will face the same issue in the exam hall.
That
That's
is
why we are
true.
sensitizing you. You will get around 30 to 40 seconds only for such a question.
Yes.
So right now is the time everyone go back to your books and revise it again. You're not supposed to miss it. Majority had given wrong answer.
Wrong. I would like to, make a point over here. So sometimes when we think that the answer is going to be the big one, but it's usually not. Like you saw erythropoietin protoporphyria, but it is not. So don't always look just because you do not know the answer. Thoda, try to think a little back, and you might get it.
Sai Taruni is leading.
Someone new. Yay. All right. So followed by Madhu, AG, Sriraj, and Medha.
Last
Nice.
question here, guys. Last question of today's quiz. Let's see how quick you are.
A 50-year-old male comes to OPD on examination, shows race, HR, pedal edema, irritability, loss of deep tendon reflexes. These signs and symptoms point to which type of thiamine deficiency. Guys, this has got to be like A or B. That is it. So I
Yeah.
hope
To give a
you know.
small clue, this isn't just about thiamine, it's about how the heart and nerves start waving red flags.
Goodness, goodness.
So still students are confused between two options. That
Hmm.
means their concepts are not that good. That's why
Yes, sir.
in my timetable which I had given, I have told to watch video specifically for this topic and to avoid notes.
Hmm.
That's true. That's true. So I think like having all of these, done from the videos as well, from the as like a first reel, gives us a big benefit. It clears our concepts.
True. So for this quiz, we have Madhu who has won this quiz. Let's give him a applause.
Woohoo!
Congrats, Madhu.
Congrats. Yeah, congratulations.
I,
Congratulations for holding the longest streak as well.
yeah, I think Tanya is our old player.
Yes.
Yeah.
She has scored,
Yeah.
yeah, she has, and
At third
Swasti
position,
also.
we have Swasti. Congratulations, Swasti.
Mm-hmm.
Fourth, we have Faizi. Sorry, fourth, we have Meda. At
Mega.
fifth position, we have Faizi. At sixth, we have Sai Taruni. At seventh, we have Rockstar. Eighth, we have Dr. Himanshu. Ninth, Narasimha. And tenth, Arya.
Yay.
So, congrats, everyone. Come back to
Congrats,
YouTube Live.
guys.
Congratulations, guys. It's wonderful what you are doing here and achieving here as well.
So, you can come back to the YouTube Live session. So I hope this was a very good quizzing session for you guys. So you know how difficult the competition is, how tough, how cutthroat competition it is right now, and why clearing your concepts in simple topics like biochemistry, simple topics in like vitamins and minerals is so important, because these are the questions where you will be creating mistakes in your exams also. Okay. So in the comment section, you can let us know if you want any changes. Daily we'll be having this quiz. We have released a schedule of this quiz for upcoming 6 to 7 days in our Instagram page, JuxtaMed. We have also released the same in the Telegram group also. Tomorrow we have carbohydrates. Day after tomorrow we'll be having lipids, and then genetics. On 13th January, proteins, and January 14th we'll be having enzymes and miscellaneous. And on January 15th, we'll be having a surprise event, that is grand finale of biochemistry, and we'll reveal the surprise in due time. Okay. So every day we'll be conducting this session at 10 p.m. So whatever you have studied daily, whatever you have learned so far, okay, so that you will be coming and you will be validating yourself, like you will be seeing how much you have answered correctly. Okay. So if there is anything which you want to tell to us, you can get to us in the via Telegram group. Okay. You can also contact us at our email ID. You can also contact us at the Instagram page. You can also comment in the YouTube comment section. Okay. So
And
we'll be
it's a good
clearing your
way
doubts.
to
Yeah.
uh, and it's a good way to correct a silly mistakes also, sir, on a daily basis. Like we are
Hmm.
doing the question bank in a live way. Like everybody is
Yes.
attending the questions. We'll know our mistakes better.
Yes. And we would, as a team, would like to highlight this point that what these quizzes that we are conducting are on the basis of the NEET-PG, and all of these questions are somehow on the other way been asked in your previous competitive exams, that is your NEET-PG and INI both. And over here, our simple aim is to keep a topic small, and so that you have a small part, small, you can revise it in between like an hour and so. And just come over here. It's a lively session. You know the answer, you do not know the answer. And even if you do not know the answer, you'll get to know the answer. So, this is one of the best things and the best way to, have it as educational and fun as well. And let me not let me not let you forget that we are giving you the rewards as well as the certificates so that you feel validated and you feel that you have done something. Whatever you have worked so much on, it's coming to some fruitfulness.
Yeah, we have some queries in the comment section that a few questions are wrong. I'll like to clarify. Especially the query is about beriberi, like why is it not dry beriberi? Because you are given two options, and the predominant symptom is
Yeah.
cardiac symptoms. Okay, cardiac symptom involvement, cardiomyopathy is caused by wet beriberi. Okay, it's not like wet beriberi and dry beriberi are both very different concepts. Okay, beriberi deficiency is single vitamin deficiency. It can cause multiple effects also, but you should see which is the predominant effect. Okay, in
And
this
there was a
predominant
good
effect
hint,
was
sir,
not,
there.
sorry.
There was a good hint also, sir.
Yeah,
The
there was a
patient
good
had
hint.
pedal edema.
Yeah,
Yes.
exactly. So there will be overlapping symptoms everywhere whenever you see, and in the exam also you'll be given similar question. You have to choose which is the most probable one. Okay.
Right, right.
Okay. So one of them has asked, don't put ranking list in between the test. I think some of them will attempt the quiz only for the ranking to show that they have studied. You can enter your names whatever you want, but then your same names will be entered in the certificate if you're in top three
Yeah,
positions.
yes.
So be careful. Okay. So this was one question, and few more questions. Okay, one more doubt we are getting regarding porphyria. We'll just verify this and we'll put the correct information in the Telegram group. Okay, in case many of them are having doubt like why is it not the why it is erythropoietic porphyria not the answer. So we'll just verify it once and we'll put in the group. Okay. So if anything else, let us know. Tomorrow also at the same time we'll be having carbohydrate session. Okay. So in that session, we'll be discussing carbohydrates, and one of them has asked to increase the number of questions also. We'll try, but we'll keep around 10 to 15. That is because in your biochemistry exam also, you'll be given only 10 questions from biochemistry total, okay? So not in biochemistry, in NEET exam, okay? That's
Yeah.
why we have kept the questions around same. For the grand finale, we'll be having more questions. We'll be having around 20 questions, okay?
Right.
So no, these questions, these rounds are not related to grand finale, okay? Grand finale is entirely different, okay? Grand finale is entirely different. So we'll be seeing grand finale rules separately. We'll be releasing it in due course. Okay. So we'll be letting you know the rules of that. Okay. So tomorrow be live at this time. Okay. So we'll be expecting you. We'll be again putting message in the Telegram group, in Dr. RMD WhatsApp channel, in Instagram page of JuxtaMed. Okay. So this is a fun way to study. This is a fun way to learn. This is a fun way to answer questions rather than going through boring Q bank,
Yeah,
as I would say.
yeah, yeah.
So you
Yeah,
can
definitely, sir.
compete in real time with your participants. Okay.
Right.
So yeah, let everyone know about this. Like for example, if you're studying in a coaching platform or you're like studying with your batchmates or your friends, do let them also know like how this quiz is being conducted, and you can compete with them in real time. So this is going to be real fun. So yeah, we'll be going on with this session. We have had a good response. So thank you everyone for participating, and special thanks to my team, Dr. Rupal and Dr. Manoj, for preparing these questions and for conducting this quiz in a smooth way.
Thank you,
Thank
sir.
you. Thank you,
Thank you,
sir.
guys.
Yeah. All right, guys. This was a very fantastic diagnostic workout. Thank you for joining us and sharing your brilliant minds.
Yeah, I guess it was a good cardio for your brains as well.
See you tomorrow then, guys. Till